was getting blind. After they found a doctor, we went to that place and we paid $600 just for the checkup. And finally he told us that she was getting fine, but she needs more treatments and she needs more analysis on her eye and all that. And after a few weeks, we got a leave from the emergency room, which I couldn't pay. I didn't have the money to pay it because it was almost $2,000.
He wanted to work to build a house for his wife. You know, he left his family behind. He can't talk to them.
He's the father of 4. He has a wife as well. He has 5 dependents. He's the only one in the home who works. And he's been unable to go to work because his heart condition prevents him from working, and he still hasn't been able to see that specialist.
We understand the problem because it's affecting our communities here in the backyards.
My name is Phil Cerna, and I serve as the chairman of the Sacramento County Board of Supervisors. So I'm here to hear from a number of advocates on the subject of health service restoration for the undocumented population here in Sacramento County. It's in preparation for a workshop that is scheduled for Wednesday, March 18th at 2 o'clock in Board Chambers in downtown Sacramento. I'm convinced it's one of the most important local policy subjects that the Board of Supervisors needs to have a very open and public discussion about. Unfortunately, in 2009, the then Board of Supervisors, in an effort to address all the circumstance of the recession, unfortunately they cut the last remaining health services for the undocumented population, again in an effort to save money to balance the budget. Now that we are beginning to leave the recession, our budget isn't growing leaps and bounds, but it's in a much more stable position than it once was. And I think now is the time to again have the policy discussion about whether or not we have an obligation as a county to provide health services to everyone. I expect to have a great amount of participation from the public on Wednesday. I think it's a very healthy thing to see in terms of the amount of participation I've seen to date, whether it be individual meetings with me or with staff. The advocacy around this subject has been growing for months now, and Wednesday will be the first time that when this Board of Supervisors discusses the subject. It won't be the only time. In June we will have our budget deliberations, and by that time we hope to be much better informed to understand the concerns of the community.